Hello, this is Katie Krause, the director of the AIDS Policy Project, coming to you from rural Maine in August 2012. I wanted to talk to you briefly about these two patients. They're being followed in Boston. They are being followed by a researcher at Harvard named Timothy Hethwick, and we actually interviewed him on our website. Under Cure Watch, you can see the interview. But basically what he's done, he was inspired by Gero Hutter, the guy who cured the Berlin patient, and he has been following these two patients who had HIV, developed cancer, failed two different drug regimens for the cancer, so they had to have bone marrow transplants, both of them. And these bone marrow transplants are pretty ordinary bone marrow transplants. They're not the kind the Berlin patient got with a special donor who was born immune to AIDS. They're regular bone marrow transplants. The difference, though, is that in both cases, these patients did not have to have extremely severe, what are called conditioning regimens, which are preparation for the bone marrow transplant, where they wipe out your immune system to prepare your body for the new immune system. Usually you have to have full body radiation and all these drugs. With these two patients, the doctors tried something new and gave them a much less dangerous, sort of severe, like less radiation, I think fewer drugs, whatever, like less toxic on their body. And because of that, these two patients who, again, had both HIV and cancer were able to keep going with their AIDS drugs throughout the whole transplant process, right? Where usually you have to quit because I guess they're afraid that the whole combination is going to kill you or something. In this case, these two patients were able to keep going with the AIDS drugs. So here's the result. Basically, the new cells that were coming in from the outside donor are not becoming HIV infected. And when the doctors check to see where the HIV was in both of these patients, there's no HIV. They can't find any HIV in these patients, but they're still taking these AIDS drugs. So we're going to know whether they were really cured when and if they're ever taken off their AIDS drugs, and we see if the HIV comes back. But for now, it's just a very interesting, cool thing. And, if it is a cure, that's amazing. If it's not a cure, it's still an amazing proof of concept that there's a way to protect a stem cell transplant from becoming infected by just giving the patient AIDS drugs. For more information, you can go to our website, www.aidspolicyproject.org, go to under Cure Watch, and we will see what happens. But it's a really cool experiment, and I think that Dr. Hethwick was pretty clever to follow these patients and to report on them, and that's all. This is data that came out at the AIDS conference that just passed in Washington, D.C. That's all for now. Bye. All right.